A warm welcome to the nursing capsule videos. Here I'm just trying to recreate all the things which I have learned in my classes which is needed for all the nursing exams. I'm trying to recreate all those things in a very concise form and I hope it will be helpful for you. Today let's discuss about the topic pulmonary embolism. Pulmonary embolism is anything which blocks the pulmonary, that is the lung, is called as pulmonary embolism. Here comes the thrombus. Okay, the thrombus can be either air, okay, it can be blood, it can be amniotic fluid, it can be fat or foreign material. Anything that's stuck in the artery blocking the blood flow to the lung is known as pulmonary embolism. What are the causes for this pulmonary embolism? Is usually the surgery, fat embolism from the long bones, okay, any fracture of the long bone happens, total parenteral nutrition, air embolism, pregnancy, immobility, atrial fibrillation. So all these leads to the cause of pulmonary embolism. What are the signs and symptoms? Sharp stamping chest pain, it's really very tough pain, okay, and then dyspnea, breathing difficulty will be there, which is very severe, and left chest petechia, that is blood spots will be seen in the chest area. That is mainly because this emboli will block the capillaries, which finally leads to the rupture of the capillaries. So when the rupture of the capillary happens, what will happen? Blood leaking will be happen from the capillaries. That will be seen like the pinpoint blood spot in the chest area. Okay, so then cough, it will be either sputum or blood. Neck vein distension will be there. It can lead to heart failure, hypotension, patient will look pale, anxiety, impending dawn of death because of the patient is really restless, breathing difficulty is there, chest pain is there, all because of this one. Patient will feel that he is going to die. That is what is called impending dawn of death. Cyanosis is the bluish discoloration, drowsiness because the patient is not getting proper air, which can lead to the drowsiness of the patient. What are the diagnostic services in which it can be done to find out or rule out the pulmonary embolism? The main thing is pulmonary angiography. We all know that it's a radiological investigation in which a dye is injected to the artery, in which they can find out where is the blockage in the lung area. Then CT scan, MRI, ultrasound and blood test. Of course, blood test is very important so that we can find out what is the cause. Is it respiratory acidosis, alkalosis, things like that. And what are the interventions for pulmonary embolism? Is administer oxygen high concentration through the face mask, elevate the head of the bed. You know that when you elevate the head of the bed of the patient, the thoracic cavity will increase so that there is more space for the air exchange and more consumption of oxygen can be done. So that is the prime reason of elevating the head of the bed. ABG analysis, as I have told you, we need to find out what type of acid-base imbalance is there. So for that one, vitals, as for all the cases, irrespective of whatever it is, vital signs is very mandatory. Then IV morphine, we know that the patient is very anxious and all those things, so we don't want the patient to be restless. So to sedate and to make the patient relax, we are giving morphine because increased metabolism, increased movement of the patient will leads to the increased consumption of the oxygen, which leads to decreased oxygen supply to the heart, which we don't want to happen. Okay, then strict bed rest, okay, mainly for this one. Immobilization will be there. We are not making the patient to move around. Infusion of heparin. Heparin is one of the prime management in which that we want to we want to correct the prime cause, okay, the main cause. The main cause is the thrombus. So we want to either to dissolve the thrombus or to remove the thrombus, and moreover we don't want further formation also. So for all those things, the injection heparin is being infused, or IV thrombolytic medications. IV thrombolytic medication like Activase and triplies are one of some of the medication which lyses or break down the thrombus. Okay, prophylactically what we are doing is vena cava filter, okay, or it's otherwise called the umbrella filter, which is being placed in the inferior vena cava so that it prevents the clot from getting into the lung. So that is what we are. And surgical intervention for that is pulmonary embolectomy. Okay, so pulmonarily, through the invasive procedure, they try to remove the embolus. Otherwise, percutaneous thrombectomy, even percutaneously, they will insert the needle like bore like thing, and then they are trying to remove the embolus. Okay, so this is the surgical intervention. Nursing diagnosis is ineffective gas exchange related to the dead space in the lung. Okay, that's the air embolism. So because of this one, what nursing intervention, what we have to do is pulmonary position we have to give to the patient, that is left lateral with Tendelberg position. Okay, Tendelberg position, as we all know that head will be down, little bit down comparing to the leg, and leg will be up. Okay, so the head will be down, legs will be up. So like this position, in which it helps to trap the air in the right atrium of the heart, which helps further to dissolve the thrombus. That's all for today for pulmonary embolism. See you again with more videos. Thank you for watching the video. Thank you.